Welcome to Long COVID Radical Self-Care, where I provide simple, non-medical tips and tools to help you on your healing journey. Today I want to talk about long COVID's impact on the heart, physical and emotional, and a possible connection between the two. Whether you're experiencing heart symptoms with long COVID or not, you may enjoy this video because we're going to do a little activity in a few minutes. A study conducted by researchers at the University of Missouri analyzed more than 50,000 patients' electronic medical records and identified the top 7 symptoms that are associated with long COVID. They included heart palpitations, chest pain, and shortness of breath, as well as fatigue, hair loss, joint pain, and obesity, which I suspect is a byproduct of the pain and fatigue. Dr. Jeffrey Hsu, an assistant clinical professor of medicine at the David Geffen School of Medicine at the U of C, said in an article published on the American Heart Association website that researchers have started grouping long COVID patients based on their dominant symptoms. He said one subgroup has cardiac issues, difficulty with exercise, heart palpitations, and symptoms that get worse when they're standing upright, which can be part of a condition known as postural orthostatic tachycardia syndrome, or POTS. I know many of you with long COVID are probably more familiar with POTS than you'd like to be. So what's causing the heart issues? There are a few hypotheses, but no answers as of now. Dr. Hsu's research is exploring whether long COVID may be caused by fragments of the virus in the body or damage to the lining of blood vessels. He says in the article that long COVID researchers have made a lot of progress, but in evaluating how far there is to go, he used a baseball metaphor. We're barely out of the first inning. He said it's really tough to identify an effective therapy for a disease that has just one type of presentation, but we're talking about is a syndrome that has several different ways of presenting itself. The good news is that more financial and human resources are being invested in understanding COVID and long COVID than probably any other disease in history. So that's a very, very brief summary of what we know about long COVID and the heart at the moment. Not very much. Now I want to look at the heart from another perspective, the emotional heart. Could there be a connection between emotional pain and the physical pain in the heart? That may sound pretty woo-woo, but there is evidence of a connection between emotional trauma and heart disease. There's no specific research for long COVID heart issues and emotional pain, but a paper in the Library of Medicine at the NIH reported that experiences of persistent or intense stress or PTSD and anxiety may be associated with an increased risk of developing chronic heart disease. Dr. Paula Schnur, the executive director of the National Center for PTSD, has found that trauma can contribute to chronic diseases such as heart disease, as well as type 2 diabetes and rheumatoid arthritis. Dr. Bessel van der Kolk, a trauma researcher and author, goes even further. He said there's an increase in just about every medical issue over time. But just because you go through trauma doesn't mean you'll have health problems. Other factors are at play, like your life experiences, the support you have from loved ones, and your genes. The relationship between trauma and medical issues isn't linear, he said. I have no data on this, but I suspect that many, if not most people with long COVID have experienced some trauma the past few years, including with the COVID infection itself. So maybe it's not surprising that heart problems are a lingering effect for some. Let's face it, the past few years have been pretty tough. So many things we saw and experienced were strange and unprecedented. Think back to March and April 2020 and the images that flooded newspapers, TV, and the internet. Images of empty streets and subway stations, dozens of dormant planes parked in rows on runways, exhausted nurses dressed in hazmat suits. These iconic images will go down in history as a testament to what we survived. Think for a moment about your own emotional experience in 2020 and 2021. Did you feel isolated? Did you feel a little fear? Maybe a lot of fear? Anger? What about loss? What did you lose? A loved one, a job or business, a relationship, a friend, vacations, or special events? What aspects of your lifestyle have you lost? What aspects of your health? Were you one of the unlucky ones who had severe symptoms with COVID? Were you hospitalized? It can be traumatic when you don't know what's going on in your body and nobody else has the answers either. I vividly remember being terrified one day when I felt like I was suffocating despite the fact that there was fresh air all around me. Whether you've given much conscious thought to what you've been through or not, your body knows. I believe that all these traumas and all of our hurts leave little wounds, little scars on the heart. The Greek playwright Aeschylus wrote, "Even in our sleep, pain which cannot forget falls drop by drop upon the heart." The good news is that wounds can heal. The heart can heal physically and emotionally, but it requires a little attention. The Buddha said, our sorrows and wounds are healed only when we touch them with compassion. So how do you do that? You can do it right now. I'm going to take you through a simple little exercise you can do yourself to start to release some of the emotional wounds on your heart. This will only take about 4 minutes. You can do it yourself anytime you find a few minutes to yourself. This is a bit like a mini meditation, so don't do this if you're driving or moving around. Okay, close your eyes and take a few nice deep breaths to center yourself. Allow peace and relaxation to wash over you. Now bring your focus inside your body, down to your heart. Bring your attention even closer to your heart. Imagine you can see it, and imagine that when you look closely, you can see spots and scars on it. These represent the emotional wounds to your heart. Some are big and some are small. Some are old and some are new. Some are superficial and some are deep. You may or may not get a sense or vision of the events or relationships that caused the hurt. You don't need to know what they are right now. You just need to acknowledge that you've been hurt. You can decide when you're ready to release past hurts to feel healthier and happier. Regardless of what you're ready to release, keep breathing in compassion and love. Now imagine a bright white light extending from the sky down to the top of your head like a ray of sunshine. Imagine that light coming down through your head, through your throat, and all the way down into your heart. Imagine this light is bringing love and healing to your heart. Take a breath and feel the peace and compassion flowing into you right now. Breathing compassion on the in-breath and release pain on the out-breath. Now imagine a few of the marks, any of the pain that you're ready to release, is being slowly lifted away by the white light. Imagine the hurts being lifted from your heart and merging with the white light. You may be ready to release just a few small hurts. You may be ready to release a lot of them. It's all good. Be kind to yourself. Release as much or as little as you're ready to release. You can come back and do this anytime you want. See your heart becoming cleaner, lighter, healthier as the spots are lifted away one after the other. After you've finished releasing what you want to release for now, imagine the white light moving through the inside and outside of the entire heart organ, repairing any disease and clearing away any damage, cleaning the valves and the chambers. Imagine the white light leaves behind only healthy cells. Keep breathing in peace and healing. As it finishes its work, see the white light retract back up through your throat and head, back up to where it came. And when it's gone, notice that you feel lighter. Some burdens have been lifted from you. Imagine your physical heart functioning better, healthy and strong. Take a moment to notice what it feels like to feel better. As this exercise comes to a close, know that you can come back and do this anytime you want. Take a couple more deep breaths and then bring your focus back to the room and slowly open your eyes. So there's a simple little exercise you can do to start to release some of the pain in your heart. There are deeper versions of this meditation that address the emotional pain more specifically, but this is a good exercise that you can do yourself. If you've got some emotional pain that feels too big to manage on your own, I strongly encourage you to reach out for professional counseling. You don't need to do this alone. Healing always starts with a decision, a willingness to let go of old wounds and ways of thinking to embrace something new and better. The famous poet Rumi said, "Be like a tree and let the dead leaves drop." Compassionately acknowledge and release your pain to make room for new health, new growth. Thanks for joining me. If you found the exercise helpful, I'd love to hear about it in the comments below. If you like this episode, please take a second to click the like button below and subscribe. It's free and it'll really help me get this message out to other people who could benefit from it. I'll see you again next week. Until then, be kind to yourself and each other.